Good afternoon. Today's April 3rd, 2020. I'm Rob Brandt, CEO of Mountain View Medical Center, and we just want to give everyone a brief update of where we are with our current state of affairs. As it stands today, we have run 10 tests, 2 are still pending, and we still have the 1 positive, which I'm happy to announce as of Wednesday morning has made a full recovery. We still have tests available, so if you are concerned and are symptomatic, please call our main number at 547-3321. We'll step you through the screening process and we'll test those that qualify. Next week we'll run our clinic operations much like we did this week with 1 provider, and we'll still be able to see patients in person, but we are still trying to push everyone towards telemedicine to the best of our ability. And so if you have any kind of problems or ailments, call the clinic and we'll get you set up, whether it's in person or through a telemedicine visit with our providers. I really want to thank everyone, not just the community members and the business members, but our entire county for following the shelter-in-place orders and staying at home and taking this seriously. With the increased testing that we've done this week and not having any further positives thus far, it is working. So please continue that, and thank you to all the businesses. I know you're suffering, but offering the curbside services and the delivery services that are offered throughout our county have been phenomenal and a huge help. So thank you so much for being flexible, and hang in there. Eva, can you talk to us a little bit about some of the myths that are going on?
You bet. So one of the things I wanted to share today were some facts about COVID-19. Fact 1, diseases can make anyone sick. It doesn't matter about your race or your ethnicity. Fear and anxiety about COVID-19 can cause people to avoid or reject others, even though they are not at risk for spreading the virus. Fact 2, for most people, the immediate risk of becoming seriously ill from the virus that causes COVID-19 is thought to be low. It's older adults and people of any age who have serious underlying medical conditions. They may be at higher risk for the serious complications of COVID. Fact 3, someone who has completed quarantine or has been released from isolation does not pose a risk of infection to other people. I think that's an important one as we start to transition people being positive and then coming back into the community. We need to remember that they are not a risk to us to infect us after their quarantine time. Fact 4, there are simple things that you can do to help keep yourself and others healthy. Wash your hands often with soap and water for 20 seconds, especially after blowing your nose, coughing, sneezing, or going to the bathroom, and before eating and preparing food. Avoid touching your eyes, nose, mouth with unwashed hands. Stay at home when you're sick. Cover your cough and sneeze with a tissue and throw the tissues in the trash. Fact 5, you can help stop COVID-19 by knowing the signs and symptoms. Fever, cough, shortness of breath. Seek medical advice if you develop symptoms such as if they're more severe, and if you've been in contact with somebody who has known COVID-19, or you feel like you've been in an area where they've had a lot of it, or you've been exposed that way. Want to talk to you about masks a little bit. There's a lot of stuff going on this week with people wearing masks. Is it good? Is it bad? Is the CDC going to change its mind and start recommending them? I don't have a great answer for you today. If you choose to wear masks out in public, that's fine. That's your decision. I will caution, I've read things about nobody under the age of 2 should have one on, or no one that can't pull it off themselves for fear of suffocation. We don't want people wearing them that way. My biggest concern about people wearing masks in public is kind of giving a false hope that you can be out and be more mobile than you should be. We should still be limiting our trips to the grocery store to once a week if possible, post office, as little as we can. We need to still do the stay-at-home orders that we've been given. Rob?
Perfect. Thanks, Eva. And again, please stay at home. And this is not a sprint. This is a marathon that we're in. All of the modeling is showing that we may peak as late April or early May. Time will only tell, and our community is small, so we can absolutely stop the spread of this virus through our community. So hang in there, stay strong, and join in with us on Monday. We'll give you an update through of all the events that have happened through the weekend. For a brief update on Monday, join us sometime after 5 p.m. Hope you all have a good weekend. Thank you.